I'm gonna knock on the door, hand hygiene, and introduce myself. Hi, my name is Jason. I'm gonna be your nurse today. Can you tell me your first and last name? Can you tell me your date of birth? And can you tell me what city and state you live in? And then I'm gonna ask the patient his past medical history. Is he allergic to any medications, and is he taking any medications? I'm also gonna ask the patient his height and weight, and then I'm gonna look at the lab results to see if there is a need to do a procedure on him, and I'm gonna check the doctor's orders and verify it with the MAR to make sure they're the same. I'm gonna let the patient know what medication the doctor had ordered. The doctor ordered heparin for you and Dilaudid. Have you had these medications before? If yes, I'm gonna ask the patient, what have the medications do to you? Did you have an allergic reaction to them? And are you gonna allow me to give you the medications again? And then I'm gonna ask the patient if he's able to move his lower extremities on his own, or do I need to get help? I'm gonna inform the patient, I'm gonna go get some help, and I'm gonna go get your medication. I'll be right back. So I'm gonna leave the room. I'm gonna delegate for assistance holding the patient, and I'm gonna prepare my medications. So I'm gonna wash my hands and verify my medication with the doctor's order and the MAR. So my first medication is Dilaudid 2 milligrams. The MAR also says Dilaudid 2 milligrams, and on hand I have 2 milligrams per 2 milliliters. So with my 3cc syringe, I'm going to drop 2 milliliters. I am going to assess the expiration date, make sure it's in date, and I'm gonna, with a clean alcohol swab, I'm gonna clean off the top and let it air dry. I'm going to insert the needle into the vial and expel the air. I'm gonna flip the vial and the needle upside down and drop 2 milliliters of Dilaudid. If there's any air, I'm gonna expel the air. And then I'm gonna use a one-hand technique to recap the needle with my other hand behind my back. Once it's capped, I can lock it into place and switch out the needle. Put this needle into a sharp spin and put my IM needle on. Now I'm gonna prepare my second medication, which is heparin. I got heparin here, heparin on the doctor's order, and heparin on my MAR. I'm going to assess the expiration date, which is in date. I'm going to clean off the top. And the doctor's order is 4,000 units of heparin, and on hand I got 5,000 units of heparin. So I have to drop 0.8 units, or 0.8 mLs. So I drop 0.8 mLs of air, insert it into the vial, expel the air, flip the vial and the syringe, and draw up 0.8 units of heparin. If there's any air in the syringe, I'm going to expel the air. Place it back down. And using one-hand technique, I'm going to recap the needle. Once the cap is on, I can lock it into place. Now I'm going to take my medication syringes, my medication, the MAR, and the doctor's order in the patient's room with me. So all of this is with me. I'm going to knock on the door, reintroduce myself. Hi, my name is Jason. I'm gonna wash my hands. I'm here to give you your medication. Can you tell me your first and last name? And can you tell me your date of birth? So I have 2 patient identifiers. So now I'm going to do my 5 rights. I have the right patient, I have the right time, I have the right dose, I have the right route, and right medication. So first medication I'm gonna give is the Dilaudid. With the Dilaudid, I can either go into the deltoid, which is 3 finger widths down from the acromion process, make an upside down V and use this area right here in the V, or I can do the vastus lateralis, which is 4 finger widths down from the greater trochanter, 4 finger widths up from the patella. Take the open window, divide it into thirds, and use a middle window. Because it is more than 1 milliliter, I can't use the deltoid. I have to use the vastus lateralis. So I'm going to assist the patient in comfort. I'm going to put my gloves on, and I'm going to ask the patient if he's allergic to these medications. Are you allergic to heparin, or are you allergic to Dilaudid? No. And then I'm going to ask the patient what he knows about Dilaudid. Do you know what this medication is used for? If he says no or yes, I'm still going to inform the patient. Dilaudid is a narcotic analgesic and is used to help with your pain. So I'm going to assist the patient in comfort. With my gloves on, I am going to open up an antiseptic swab. I'm going to loosen my cap of my needle, Z-track the skin, and clean from a circular motion from the inside, circular motion out. And then I'm going to grab my syringe, holding it like a dart with my thumb and my index finger. I'm going to insert the needle 90 degrees. And I'm first going to ensure that the area has no bruising by inspecting and palpating. And then I'm going to make sure that this side is not the last side the patient had the medication. And I'm going to insert the needle 90 degrees while Z-tracking the skin. I'm going to hold the syringe in place and inject the medication and hold it in for 5 seconds. 1, 2, 3, 4, 5. I'm going to take this and put it into the sharps container and hold pressure with my antiseptic swab. Once it stops bleeding, I can assist the patient into the next position for the medication. With sub-Q injections, I can use the back of the arm or the umbilical region, and because this is heparin, I have to use the umbilical region or the abdominal region. And when doing that, you have to be 2 inches away from the umbilicus or 3 finger widths away. I'm going to ask the patient where his last injection was and then use the opposite location. I'm going to inspect for bruising or tenderness, and then I'm going to loosen my cap. With sub-Q injections, if you can pinch an inch, then you can go 90 degrees. If not, you have to go 45. In this case, I can pinch an inch, so I'm going to open up an alcohol swab, pinching the skin, clean from a circular motion, starting from the inside, circular motion out, allow it to air dry. I'm going to take the syringe, holding it like a dart with my thumb and forefinger, pinching an inch, going 90 degrees in, and giving the medication in a slow IM or slow sub-Q. And then I'm going to take the syringe and place it into the sharps container and take the antiseptic swab and hold pressure over the site. Once the patient has stopped bleeding, I can clean off the area. I can clean off the patient, clean off the area, drop the bed all the way down, lift the rails all the way up, and then put the call bell beside the patient. I'm going to assess the areas for any redness, swelling, or bruising, or tenderness, and then I'm going to ask the patient how he's responding to the medication, and then I'm going to chart all my medications that I gave the patient, which is my last right, and then I'm going to wash my hands and exit the room. That's it.